All right, so there's been a lot of questions about insurance. A lot of confusion with insurance too, especially if you have the traditional red, white, and blue Medicare card and how that works at a chiropractor's office. Now, I've had a lot of people ask me, why are so many chiropractors just out of network with insurances? They don't accept insurance, they don't work with them. There's a number of reasons why. Sometimes it's just a personal preference, but also sometimes it's because of just how insurance companies work. It's not always the most beneficial thing for the patient. Just keep in mind that insurance companies are for profit. So they are not a not-for-profit. There to help you out. They are there to help you, but they're also for profit. So keep that in mind whenever you're talking about insurance companies. So this video is going to hopefully help give you some additional information when it comes to Medicare and what your costs would be in a chiropractor's office. So there are two options for chiropractors. They can either be participating with Medicare or non-participating with Medicare. If you find a chiro that is participating, what will happen is usually when you show up to the office, you might have to pay something, you might not. Just kind of depends on if you saw anybody else previously that year. But the payments get sent to the chiropractor. So it's very similar to other kinds of insurance plans where maybe, they have a copay and you might pay that. And then the remainder of the visit balance is sent to the physician. With non-participating, what will happen, because my office is non-participating, the patient will pay the cost up front, and then Medicare will send the patient the reimbursement check. So it's just really about who the check is going to. So participating means the check will go to the doctor, to the doctor's office. Non-participating means it goes to the patient. Now, Medicare does have a deductible on it. It is like many other insurance plans, there's some kind of deductible. Now, it's much lower than many others, but Medicare's deductible for 2022 is $233. This means that as a patient, out of pocket, you have to pay $233 for 2022 that you have to meet. That also only applies to covered services. So, if you get your full recommendation or treatment plan from the chiropractor and they say it'll be X number of dollars a visit, it doesn't mean that Medicare is going to pick up that full amount. Medicare only covers the adjustment or spinal manipulation. That is the only thing that it covers. When you are in active care, spinal manipulations. So that means any additional therapies or anything else that the doctor might recommend for you, not covered by Medicare. Okay, so that could be on you to pick up. So let's say the total bill is $100 for that service. Then the applied deductible is only going to be about $40 because that's what the spinal manipulation is. It's about $40. Now that will vary a little bit depending upon how many areas of the spine are adjusted. If you're only getting 1 to 2 areas, it's going to be a little less than say 4 to 5 areas. But let's take middle ground, say $40. You get a couple areas of your spine adjusted whenever you go, it's $40. But then you also have your exam, maybe the doctor takes some x-rays, does some other therapies, so your total bill is $100 for that day. That $60 is your responsibility, and it does not go towards your $233 deductible. Only the $40 from the spinal adjustment will go towards that. And if you haven't met your deductible yet, you still have to pay that $40. So total bill's $100, you pay $100, and only $40 of that goes to meet that $200 deductible. Hopefully that makes sense. I know it can get really confusing really fast with Medicare, but you got this. You got this. Now, if you go to a chiropractor's office where they take x-rays in their office, that is not covered. That's an extra service. I don't have x-ray in my office. I see a lot of pregnant women, children, so I don't have x-ray in the office, but I do have a couple imaging facilities just right around the corner. So I will refer patients there. The interesting thing is with Medicare patients, because you're going to an imaging facility, that can be covered differently. So something to think about, but also to help you kind of make sense why if you go to one chiropractor and you say, well, I only had to pay X number of dollars for that first visit, whereas my friend went to another chiropractor and they had to pay a lot more. Well, maybe your friend at that chiropractor had the x-rays taken there. They may have done extra therapies or a different kind of an exam. So just keep that in mind as to why these numbers can vary quite a bit. A lot of the traditional red, white, and blue Medicare cards will come with a secondary insurance. So we send off our billing to Medicare. Medicare will automatically forward it to the secondary insurance if you have that coverage. Now, typically, Medicare patients would have a co-insurance once you hit your deductible. So you are responsible for up to $233. And once you've met that, you've met your deductible and your full benefits kick in, which means Medicare pays 80% and you pay 20%. So that 80% is off of what's allowed. So Medicare is going to pay 80% of what the doctor charges for the spinal manipulation, for the adjustment only. Remember, not those therapies. So for the adjustment only. Now that 20%, if you don't have secondary insurance, you are responsible for that. Most people have secondary insurance though. So the secondary will pick up that 20%. So typically, once you meet your deductible, you're not responsible for anything other than additional therapies or recommendations that the doctor might have for you. I hope this sheds a little more light on how insurances work. Lots of different pieces of it, of course. But if you ever have any questions, make sure that you ask your physician's office. They can explain to you exactly what is covered and what is not covered. Dr. Nicole here with Stewart Chiropractic and Wellness, where your healthcare begins.